Time to give our update on COVID. Okay, see, I'm learning from this guy over here. Thought we'd start today by we'll just review a little bit of data, current data. Again, I hope you appreciate this. This is just our chance to, every time we get up in front of you, kind of look at how we're doing nationally in terms of our cases per capita. We're really not moving a whole lot there. There's been a pretty significant outbreak in Pine Bluff, Arkansas. That has never been in the top 10. They're kind of rising up there. Sioux Falls is still holding pretty steady, this time at about 660 cases. When we say per capita, that's per 100,000 residents is that data. We darken this up, hopefully to make it a little easier to view on camera as well. What we've seen the last probably 5 days or so is a downtick in the number of active cases. So we've had more recoveries, and you've seen the numbers. We've been averaging that 70 to 80-ish cases in our MSA the last few days. Because of those recoveries, obviously you would likely expect there has been an uptick a little bit in the hospitalization rate, up to north of 7%. It's the first time we've been north of 7% in the hospitalization rate, but that's also just because we have a lower downtick there. So obviously this is numbers that we like to see, but again, we're not calling this a consistent trend yet, because we're still, again, on target, on track for our mid-May to late May peak. Is still the projections and the data that we're working off to see that happen. Want to have a quick discussion about Smithfield. Yesterday, right about 24 hours ago, the CDC released a report from Smithfield, or excuse me, on Smithfield, regarding the recommendations that they have for that plant to make in order to return to full production and return online in a safe fashion. This morning we did have a conversation with a representative from Smithfield about that. I will tell you that they've had the report for a day. They're digesting that, and they're coming up with a plan of action or working on that. And so we don't have any timeline for Smithfield returning to operations. We don't have any further information on that, but I want you to know that our office is working closely with Smithfield on that. I took a call yesterday. I probably had 20 calls yesterday from pork producers across the region. One that sticks out to me was a gentleman who had euthanized 3,000 hogs this week because there's no market for them, no place to take those hogs. And so it's important for the public to know, for our ag community to know, those producers to know, we absolutely understand the upstream and downstream ramifications of having that plant closed, and that is not lost on us. We are committed to getting that Smithfield plant open as quickly but as safely as possible. And sometimes speed and safety in this environment don't necessarily run parallel all the time. So quickly and safely is how we want to see that plant open. We're working with them on that, and we're going to continue to have dialogue with Smithfield on that. The only other thing I'll share with you today is it's been a really great week to see people getting out and getting active this week. The weather's been good. That also creates sometimes some gatherings en masse outside, which we're still obviously advising against. But we've been challenging people to get out and try and run or walk 100 miles in 100 days. There's been thousands of miles logged already in this city. It's a great challenge, great for your mental health, physical health. We're going to be giving out a few prizes today. Some people from our office will be in touch with folks on that. So just want to continue to encourage people to do that. It's important to do that, to keep your mind sometimes off COVID in this time. There's other things happening in addition to COVID. A great thing, before I turn it over to Jill, we're breaking ground on a new fire station in about 2 hours here on the east side of town. That project has been talked about for the last, probably 6 or 7 years. We've needed a fire station on the east side. We're paying cash for that fire station. We're going to turn some dirt, and we're going to get that thing built on the east side. Good for public safety, good for our response times on the east side of Sioux Falls. So still good stuff happening in the city. Business goes on. It's not all just COVID. We got a lot of work we're doing on non-COVID related things like that. So thanks for your time. I'm going to turn it over to Jill for a few updates from the public health team.
Great, thank you, Mayor. So this morning you heard the governor talk about the fact that she has extended the executive order for those over 65 and those with certain health conditions to continue to please stay at home. That brings us to just what we need to talk about today to remind everybody what are the various ways that we are mitigating the spread of COVID in our community. And one is the social distancing piece. And just to remind everybody what social distancing does is it just continues to keep us apart from each other, 6 feet or more apart from each other, so that we can continue to mitigate the spread. And that would be for anybody who feels well, anyone in our community, that we all need to be mindful of that. Not just, in our workplace, but even in our homes and other places that we are. When we're out and about, maybe we have to go to the grocery store, make sure you're mindful of being 6 foot apart from someone. If you have to go run an errand to get your medication and there's not a drive-through to do that, make sure you're staying 6 feet apart from someone. And we would really appreciate it over this weekend that you're only going out and being amongst people in like enclosed spaces where you have to be for those types of errands, that you do so as minimally as possible. And like the mayor said, it's important that we're getting outside, however, and we have the right density in our community that there are places we can do that. And so, getting out and taking a walk on the sidewalk, getting out and going on our bike trails, getting out and running in our open spaces is really important right now and something that's good for all of our mental health. So, but doing it in a socially distancing way. Another piece that we talk about a lot is quarantine. And quarantine is a circumstance in which you've perhaps been in contact with someone who is positive for COVID. It doesn't mean that you yourself are positive, but it means you now have come into contact. You've been in close contact of someone who is positive for COVID, and you now need to quarantine, because we now need to understand of whether or not you're going to develop COVID. And so you need to be able to set yourself apart from those in your home if you are under quarantine. You need to take that seriously. You're going to know that because the State Department of Health, someone from the health department at the state level is going to be telling you that you need to quarantine. And so that's something you need to take very seriously. You need to then be watching for signs and symptoms that you may possibly be getting sick. You need to check your temperature a couple times a day if you're in quarantine. And you need to, as I said before, stay away from people as much as possible, especially people that are high risk for becoming quite ill with COVID. The last is, once you have been identified as being positive for COVID-19, then you would become isolated, and you would need to go into isolation because you're now positive. So that's something that's very important to remember as well. And again, you're going to understand that from someone at the State Department of Health and others that are helping to monitor you, perhaps your healthcare provider, etc. Once you've been positive, then you will isolate yourself. And so there is a difference between all three of those things. There's social distancing for just the general population, there's being under quarantine if you have been exposed to someone, and then there's isolating yourself if you've actually been identified as being positive for COVID. And so that's an example of where in your home, when you're in isolation, you really need to make sure you're staying away from everyone else in your household. Others need to be, providing care to you, but, to your door of your bedroom, for example, or of any place that you can be. Maybe it's in a lower level area where you can be. Try not to, if possible, use the same bathrooms, etc. Having food brought to you rather than going to the dining area of your home or dwelling. Things of that nature, but keeping yourself isolated as much as possible, and that is something that's very, very important. So we then, lastly, there's sometimes when it's not possible for someone to successfully do that in their home or dwelling, and that they may need to isolate themselves or they may need to quarantine in another location to be able to do that safely for the rest of their household, for example, or people that they live with. And so that's where we would then be helping to refer them to an isolation site, and those are those places in our community that we're working to have developed and ready to, we already have some people doing that in our community, but we'll be continuing to step that up in a larger way as we have more people that may need a place apart from their home or dwelling to do that. And so an example of that might be, you know, two people that are living in an apartment, for example, and they only have one bathroom. Or it might be a family where, you know, you can't isolate someone into a room effectively. The home is just too small for that. Having a single bathroom is a really good example of that, because that's an area that can be commonly used and you can possibly be exposed to the virus by using that together. So we just want to, I thought it was good today to, on Fridays, I'm always, you know, sharing if the weather is nice out, people are going to have a tendency to get out more and be more out and about in the public. And so please make sure you're social distancing. Make sure if you've been told to quarantine, you are doing that. Make sure if you are COVID positive and you are isolating yourself at home or another location, that you are following those orders and those directions. And let's just continue to mitigate the spread of this virus in our community. So thank you. Mayor?
All right, any questions for Jill or I today?
Can you talk a little bit about certain areas in Sioux Falls, like Heritage Park has become a problem, and the neighbors have noticed that there's large groups of people there, 20 or 30 a day. What can you do to educate those people to get them to follow the rules? Because it seems like they just don't want to do that, and they're going to go on to other places.
Yeah, the question was parks where there's large gatherings of people, large groups of people gathering. All we can continue to do is preach the message of social distancing and being smart and encouraging people to get out, get exercise. Exercise is not banned in the city. It's not canceled. But we need people to not gather in groups. Right now, it's not illegal. That's the problem, Kevin. It's not against the law to do. We're advising against it. So all we can do is continue to ask people to not do that. Obviously, we don't want to turn our law enforcement officers into the the bad guys that are having to break up soccer games and so forth. But there's times when we have to tell people, hey, listen, I know you want to be together right now. I need you to just kind of stay apart a little bit at this time. And it's hard. It's hard for my own family. It's hard for me. But that's why we stand up here every day and talk about this. Hopefully get the message continues to get out into the public.
How many isolation areas have been set up within the city so far?
I believe we have 2 isolation facilities that we've set up in the community. Potentially more. We also have a third, I'll call, I don't know if isolation center is the right term, but I guess it is at USF, where we're housing some of our first responders and some of our city employees who maybe they have at-risk people at home, maybe children with respiratory diseases and so forth. So some of our police officers and first responders, our respiratory calls that our fire rescue taken are increasing. So they're dealing with people on a daily basis who are dealing with respiratory issues. They don't know if those people are COVID positive. So when our firefighters come home, they have to decide, do I want to go home where I have a immunocompromised child, or do I want to go stay at a dorm at USF for a little while to make sure that I don't become symptomatic. So we've worked out a deal with USF. That's kind of the third site we have where we have some of our city employees that are able to stay there. So thank you to USF for partnering with us on that.
Can you tell us about how many city employees are there right now?
You know, we've had a couple dozen that have expressed interest in that. It's about right, isn't it? Yeah,
I know you were offered 1 or 2 hotels, I think, for the same thing. Have you taken advantage of that? Have you pursued that? Yeah,
we're working with a couple hotel properties in the city for some of these vulnerable populations and people who need to be isolated, just like Jill talked about, for a variety of reasons. We expect the need for those isolation centers to grow, and in fact, one of the items in the Smithfield report is the desire or the recommendation that their employees and their family members need to have access to proper isolation facilities that they can utilize, which is why early on we knew we would have to stand up kind of some isolation centers and some programs around that. All right. Last thing I'll say is this purple was intentional. Vikes had a good draft last night, if anybody watched it. People are so hungry for sports. I watched the draft. It was great. So you guys have a great weekend. Stay safe. Appreciate it.